So thanks for having me today. So along with my co-authors and colleagues, we um, performed this study examining smoking usage, tobacco usage patterns and effects on outcome for early stage patients. So the reason we underwent this investigation is it's well known now that tobacco use has a lot of negative health effects for people in general, and that cancer, it probably represents about 30% of cancer-related deaths. This is especially prevalent for lung cancer patients, as about somewhere around 85% of lung cancer patients or lung cancer is related to tobacco use. Just one caveat is that I think it's important for everyone to understand is that not all lung cancer is from smoking, but a good proportion is, and it's important to address it. So the fact that tobacco use leads to lung cancer development in many patients is not a surprise, but what's a little less known is kind of what happens to patients once they're diagnosed with lung cancer and they continue smoking. Surprisingly, given the clear association between the two, you might be surprised to know that very few prospective studies on clinical trials have examined what happens to patients once they're diagnosed with lung cancer, and what happens to their tobacco use, and how does that affect their eventual outcomes. There's lots of retrospective data, single institution studies, things of that nature, that in general show that continuing smoking plays a negative role in their treatment and outcomes. My co-investigators and myself wanted to see how